Students, today we will discuss about chapter A Tomb of Surgery. It is written by James Alfred White and his paid name was James Harriot. He was British veterinary surgeon as well as writer. According to this chapter, there was a rich lady, Mrs. Pomfrey. She had a pet dog named Tricky. Tricky had become very fat and his mistress was very worried. What will happen to him if he could not recover? For the same reason, he was sent into hospital, animal hospital, and what happened there in this chapter, author who is also narrator of this story. The narrator starts telling us that how he was worried about Tricky, a pet dog. The narrator stops his car as he sees Tricky with his mistress on the road. As narrator is shocked to see Tricky because he looks like a bloated sausage, mince meat full of blood. There was, there was a watering tongue. Mrs. Pomfret started explaining that Tricky was listless. It means lack of energy. Tricky did not have energy, and Mrs. Pomfrey thought that Tricky must be suffering from malnutrition. That's why she was giving extra meal like malt, cod liver oil, bowl of Horlicks, so that Tricky could sleep well in the night. And doctor asked from Mrs. Pomfrey if she cared the dog. And Mrs. Pomfrey replied that Tricky had become so weak and she was very hopeless. That's why she could not escape from giving cream cakes, chocolates, everything, and Tricky ate everything. Narrator again looked at the little dog, and the trouble was he always ate too much. He did not refuse food, and every day and night he always ate. Then narrator asked from Mrs. Pomfrey if he was doing any exercise. Then Mrs. Pomfrey replied that she was making him to do exercise with the help of gardener named Hoskin, but there was a problem that gardener was suffering from a back disease, lumbago, back pain, back muscle pain. That's why he was unable to throw a ring properly. Narrator started explaining that if Mrs. Pomfrey would not cut food right then the dog would not recover, and she must be hard, strict. She must give him strict diet. But Mrs. Pomfrey, she was against it. It was very difficult for her to be off the route, and after some time it was the great concern that Tricky he was unable to walk properly, and it was the cold weather and different types of coats was provided for Tricky. Mrs. Pomfrey cared too much. Then after some time the call came from Mrs. The call came to Mrs. Pomfrey by the doctor that Tricky would be hospitalized. Tricky was not eating. Tricky was not eating his favorite dishes, and he was vomiting, and he was always lying. Then the plan was made that if Tricky would be cared properly, he would be hospitalized for about fortnight. It means 15 days under observation. Then he must cure. The poor lady became fainted. She was sure that she would die if Tricky would be sent to hospital. But it was for the Tricky. Tricky was very ill. He must be saved. And there was nothing except saving him. And without delay, she became ready. Doctor came with car to carry little dog Tricky. The whole staff, maids, all were ready to bring Tricky the hospital. His every goods things were kept in the car, like day bed, night bed, favorite cushions, toys, rubber rings, breakfast bowl, lunch bowl, supper bowl, everything. And so much things were there that everything could not be kept in the car. And some things were left. Doctor took Tricky into the car and he started driving. Narrator looked in the mirror and he saw that everyone was weeping. Nonetheless, he was unable to do anything except taking Tricky with him. That's why he showed love to Tricky and he showed love to Tricky and he went straight towards his hospital. That's all from this part. In next part, we'll discuss about the remaining story. Thank you.